Question number 1. How many units heparin added in NS for catheter flushing? A. 50 unit by 500 ml. B. 500 unit by 500 ml. C. 5000 unit by 500 ml. D. 50,000 unit by 500 ml. Right answer B. 500 unit by 500 ml. Question number 2. Central line catheters should be flushed with the A. Heparin. B. NS-0.9%. C. D5. D. NS plus heparin. Right answer D. NS plus heparin. Question number 3. Central line dressing changed at every A. 24 hours. B. 3 days. C. 5 days. D. 7 days. Right answer D. 7 days. Question number 4. Center line insertion site cleaned with the A. 70% alcohol. B. Chlorhexidine 0.5%. C. Betadine. D. Sprit. Right answer B. Chlorhexidine 0.5%. Question number 5. Most commonly catheter used in children. A. Groshong. B. Broviac. C. Leonard. D. Hickman. Right answer B. Broviac. Question number 6. Most common complication of subclavian vein and intrajugular vein central line are A. Infection - pneumothorax. B. Pneumothorax - thrombus. C. Thrombus - infection. D. Anaphylaxis - pneumothorax. Right answer B. Pneumothorax - thrombus. Question number 7. Most common complication of femoral vein catheter is A. Infection. B. DVT. C. Anaphylaxis. D. Pneumothorax. Right answer A. Infection. Question number 8. When caring for a client with a femoral venous catheter, it is essential for the nurse to A. Irrigate the catheter with sterile saline solution to maintain patency. B. Maintain sterile technique when working with the catheter. C. Assess the pressure dressing frequently for bleeding. D. Limit the mobility of the affected limb. Right answer A. Irrigate the catheter with sterile saline solution to maintain patency. Question number 9. A nurse is caring for a client who receives an intravenous solution of 0.45% sodium chloride. In what category of fluids does this solution belong? A. Isotonic. B. Isomeric. C. Hypotonic. D. Hypotonic. Right answer C. Hypotonic. Question number 10. What clinical finding does a nurse anticipate when admitting a client with extracellular fluid volume excess? A. Rapid 3D pulse. B. Distended jugular veins. C. Elevated hematocrit level. D. Increased serum sodium level. Right answer B. Distended jugular veins. Question number 11. A nurse is caring for a client with diarrhea. In which clinical indicator does the nurse anticipate a decrease? A. Pulse rate. B. Tissue turgor. C. Specific gravity. D. Body temperature. Right answer B. Tissue turgor. Question number 12. A client reports vomiting and diarrhea for 3 days. What clinical finding will most accurately indicate that the client has a fluid deficit? A. Presence of dry skin. B. Loss of body weight. C. Decrease in blood pressure. D. Altered general appearance. Right answer B. Loss of body weight. Question number 13. A client is caring for a client with ascites who is receiving albumin. What infusion rate and oral fluid intake should the nurse expect to have the greatest therapeutic effect? A. Slow IV rate and liberal fluid intake. B. Slow IV rate and restricted fluid intake. C. Rapid IV rate and withheld fluid intake. D. rapid IV rate and moderate fluid intake. Right answer, B. Slow IV rate and restricted fluid intake. Question number 14. A nurse is caring for a client who is receiving serum albumin. What therapeutic effect does the nurse anticipate? A. Improved clotting of blood. B. Formation of red blood cells. C. Activation of white blood cells. D. Maintenance of oncotic pressure. Right answer, D. Maintenance of oncotic pressure. Question number 15. What is the maximum length of time a nurse should allow an IV bag of solution to infuse? A. 6 hours. B. 12 hours. C. 18 hours. D. 24 hours. Right answer, D. 24 hours. Question number 16. A client's IV infusion infiltrates. What does the nurse identify as the most likely cause of the infiltration? A. Excessive height of the IV bag. B. Failure to secure the catheter adequately. C. Contamination during the catheter insertion. D. Infusion of a chemically irritating medication. Right answer, B. Failure to secure the catheter adequately. Question number 17. A nurse is caring for a client who is receiving an IV infusion. What should the nurse do first if the IV infusion infiltrates? A. Elevate the IV site. B. Discontinue the infusion. C. Attempt to flush the tubing. D. Apply a warm and moist compress. Right answer, B. Discontinue the infusion. Question number 18. A nurse is caring for a client during the emergent phase of a severe burn injury. Which parenteral intervention prescribed by the doctor should the nurse question? A. Colloids. B. Potassium. C. Hypotonic saline. D. Lactated Ringer's solution. Right answer, B. Potassium. Question number 19. A patient receiving IV therapy via central line develops hypotension, cyanosis and tachycardia. The nurse notes a crack in the IV tubing. Which of the following actions should the nurse take first? A. Have the RN call the physician. B. Clamp the tubing and administer oxygen. C. Raise the head of the bed. D. Slow the infusion and lay the patient flat. Right answer, B. Clamp the tubing and administer oxygen. Question number 20. Which of the following solution is isotonic? A. 0.45% NS. B. D5 by 0.2% NS. C. D5 by 0.45% NS. D. 0.9% NS. Right answer, D. 0.9% NS. Question number 21. The nurse is assessing a patient and notes a silicone catheter taped to his chest and can tell the catheter under the skin. This type of catheter would be a peripherally inserted central catheter. B. Implanted port. C. Central venous tunnel catheter. D. Percutaneous catheter. Right answer, C. Central venous tunnel catheter. Question number 22. A client is receiving an IV infusion of 5% dextrose. The skin around the IV insertion site is red, warm to touch and painful. The nurse should first A. Administer acetaminophen. B. Change the D5W to normal saline. C. Discontinue the IV. D. Place a warm and moist compress. Right answer, C. Discontinue the IV.